Yikes.
Sounds good.
I'm going to turn off my sound, or I'm going to mute myself.
Yes, so we'll go on mute.
And yeah, and Kai and I had kind of decided that as like the other person was presenting, we would turn off our videos just so it would kind of be kind of a singular focus. So
yes, so I will start and welcome everyone. Then I'll turn off video and turn it over to you guys.
Okay, perfect.
Okay, it looks like we're on. Welcome everybody. We will get started in just a few minutes. Welcome everybody. Kai, it looks like I have a black box in front of your screen. I'm not sure if you can. Do you guys see that or?
Mm-hmm.
There we go. That's better. Okay,
it was the
great.
chat box for some reason. It wasn't.
Okay. Well, welcome everybody. We are so happy you're here to join this training about 10 things parents need to know about why we immunize babies. We have two excellent presenters. They're health educators with the Arizona Department of Health Services Maternal Development Department. One is Kai McKinstry and Wendy O'Donnell. We're so happy they're here. If you have any questions during the presentation today, please use the chat. We would love to answer any questions you may have. And if we don't get to your question right away, we will send a copy of all the questions and answers to your email after the training is over. So go ahead, Wendy and Kai, you guys can take it away.
Hi, good afternoon. My name is Kai McKinstry. I am a certified health education specialist with a bachelor's in public health and a background in public health. Thank you so much for being here today. We'd like to discuss the 10 things parents need to know about why we immunize babies, as well as some of the harder to answer questions. We'd like to try to help to kind of tackle those so you've got the knowledge to kind of encourage families and primary caregivers to vaccinate their little ones. We also have Wendy O'Donnell with us. Wendy, would you like to introduce yourself?
Sure. Hi, my name is Wendy O'Donnell. I have a master's in public health and I'm a master's certified health education specialist. It's a mouthful. Basically just means I have a background in health education. Immunizations are a passion of mine, both as a public health professional and as a parent myself and a member of a community. I think it's super important. So I really hope that you leave here today with answers to questions that you commonly hear, and that you feel empowered to tackle those questions with the parents that you come across every day.
Absolutely. And yeah, as Wendy said, we're both kind of coming at this from a professional perspective, but also from a personal perspective as parents who immunize our kids. So this really is something that we feel passionate about, and we are going to try to teach you some of the things that we've run into as professionals, but also personally. So let's get moving. Maybe. Okay, so the first thing we're going to tackle is some housekeeping stuff. Wendy and I are presenting on behalf of TAPI, the Arizona Partnership for Immunization, as well as CAHEC, Central Arizona Area Health Education Center. So thank you again for logging on to this fairly short but jam-packed seminar. Couple of reminders. Most of us are probably working from home right now, myself included. Most of us are probably wearing pants. Some of us statistically probably are not. So as we're home and kind of doing our thing at home, please make sure your microphone is muted. We do have the chat box turned on, so please utilize that resource. Questions, comments, concerns. Coming down the way here, we're going to ask a couple of questions that we are asking for your participation in. So please make sure you have access to that chat box so that you can type in your, questions, comments, and concerns. If you have any technical issues, I mean, we know that this happens. We had to sort out a bunch of technical issues first thing here. Please message the administrators and they'll try to help you with any of those technical issues for troubleshooting. And then as was stated earlier, all of these handouts and resources will be available for you at the end of our training today. So please don't panic if you didn't get a chance to screenshot something or write it down. It's all going to come to you at the end of the presentation. All right, moving right along. And you're going to kind of see me reference my notes off to the left here a little bit. So sorry about that. You do have my undivided attention, but I do technology. It's not my thing. All right. So what we're going to do today is tackle some of the 10 things parents need to know about why we immunize our little ones. We're also actually going to talk a little bit why we vaccinate throughout our life, but there is a particular importance to vaccinating babies. And so we want to make sure that we touch on that. And thank you for the Arizona Telemedicine Program and Southwest Telehealth Resource Center for making our event possible. We really appreciate this. We're going to watch a short clip. It's going to take me just a half a second to get it set up for you to watch. But this is actually a really interesting video about some of the things that we tend to forget about vaccinations. All right, let's go ahead and play this.
I want to tell you about a time
in American history so that
it never repeats itself.
So it never repeats itself. It was a harrowing time.
A heart-wrenching time.
I could hear my mother warn me, Seal, don't go out and play.
My family was ravaged.
Thousands and thousands died.
I was scared.
So scared.
And then one day.
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
diphtheria,
Hib,
Whooping cough.
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here.
I'm here
to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
And I'm going to get you back on the presentation here. Okay, great. All right. So that's just one of the really more powerful presentations or videos, I should say, that kind of discusses some of the issues that we run into around vaccination amnesia and public health amnesia. And really what that looks like is an initiative ends up being so successful that a couple of decades down the line, we really start to forget the difficult things that our ancestors had to experience. It turns into a problem that becomes cyclical and that we start seeing again. So one of the topics we want to touch on, of our 10 things parents need to know is number one, that kids are at risk for disease. And you may remember last year, early 2019, there were measles cases that all of a sudden popped up around the US as an endemic. And we ended up having 1,250 confirmed individual cases of measles across 31 states in the US, where we thought that measles were predominantly eliminated. We really have started seeing these things pop up again. Arizona kids are especially at risk. And this is important for us to know. One of our public health initiatives is to have 95% vaccination amongst our population, our general community. And because Arizona is not reaching that 95% vaccination or immunization rate, we are now a hotspot for kids, for Phoenicians, for kids who are potentially vulnerable. So our vaccination rates are low, our herd immunity, our community immunity is low. And so our kids are particularly susceptible to vaccine preventable diseases. There is a link there at the bottom that you can jump on or screenshot it if you'd like. that shows the article here that gives us the data for this. Okay, so I'm sorry. I am going to torture you for about 2 minutes, and this is a tough video to watch, but I need you to watch it. This is kind of one of those things that really helps us understand that vaccine preventable diseases, measles, mumps, pertussis, which is whooping cough, pneumonia, still affect and cause significant illness in children in the USA each year. This pertussis one is tough to watch, but please, again, I'd really like you to watch it. And if you have an opportunity to take these resources and share them with the parents or the primary caregivers that you interact with, this, I think, is one of the most powerful videos that you can show them.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath in, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here. Yeah. It's okay. Yeah. Okay, sweetie. Right. It's okay. Yeah. It's okay. Yeah. I know. Yes. Oh, I know. It's okay.
Okay, so let me just wipe the sweat away here and the tears. This is definitely one of the most difficult videos to watch, especially for those of us who are parents of little ones. It is incredibly important for us to remember that we may never encounter these diseases, these vaccine preventable diseases in our lifetime, and we are extremely lucky for that. But maybe we will. And we'd really like to be able to keep these diseases very, very much at bay, or even eradicated in a perfect world, which we could achieve through community immunity and vaccination. So again, if you can pull that resource and show it to folks, it's very powerful. I've watched it like 6 times and I still can't keep myself together over it. Okay, so topic number 3, outbreaks are preventable when parents make the decision to vaccinate. So we talked about this 95% vaccination rate that we'd like, or immunization rate that we'd like to achieve. That is ideal for keeping a lot of these outbreaks at bay. When we immunize 95% of the population against a vaccine preventable disease, we can prevent an outbreak from happening. We need a community effort to protect our children. We call this community immunity. And I kind of like to think of this as like a fence. If I am immunocompromised or vulnerable in any way, like I've got twins who are 8 months old and they spent quite some time in the NICU and they are immune compromised. What we do in my family and my household and in the community that surrounds my kids is we all get vaccinated, flu shots, everybody's up to date on all of our vaccinations, so that our little ones who can't get all of these immunizations quite yet are protected by this kind of fence of people who are immunized. Because if it gets to me and my body can tackle a disease, I can stop it before it gets to my little ones. And that's the idea here behind community immunity or herd immunity. So even though our vulnerable folks can't get vaccinated, those of us who are healthy and can should, so that we can protect those others with that fence around them. Okay, number 4, this one's really exciting. I hope you can see the graphic. Those of you who are on your phone, please make sure you pull this up some other time, because this one is actually really cool. This gives you that studied, proven information that you need to kind of help folks who are on the fence or questioning whether or not vaccinations work or are good for the population. So we know that vaccines work. And if you look at this graphic, you can see smallpox, which is a really exciting huge accomplishment for public health. Smallpox was eradicated in 1980. It was decreased by 100% because vaccines work. Diphtheria, we haven't had an outbreak since 1970. We have decreased the incidence of diphtheria by 99.9%, which is extremely significant. I mean, that's really cool. Pertussis, which is whooping cough, that's the video we just heard. We're not where we need to be. We don't have that 95% immunization statistic or number. So we do still have cases of pertussis popping up. It is circulating. We are decreasing, we have decreased pertussis to 94.9%, which is good. But we really need to hit 95% by encouraging folks to be armed with this information. Tetanus is down 96.7%, which is great. Neonatal tetanus is gone, which is awesome. Polio. There's a generation of people alive today who experienced how polio has ravaged communities. We eliminated polio in 1979, which is phenomenal, and we can do this again with the other vaccine preventable diseases that are currently circulating. We did have that measles endemic that we spoke about just a couple of slides ago in 2019. We thought we had it eliminated in 2000, but we'll watch a video a little bit later on about how something that is eliminated can rear its ugly head a little bit later down the line. Congenital rubella is gone, eliminated in 2004. And then we've got, the ones that are below here: rubella, HIV, Hep B, perinatal Hep B, Hep A, and varicella, which is chickenpox. All of these are doing great, excellent public health initiatives that we'd like to see eliminated or eradicated sometime in the near future. So vaccines are studied. It's important to know that vaccines are studied. They are studied inside, inside, outside, upside down. Vaccines are followed to see how well they are working. We're not using the same vaccines from 1910. We have vaccines that have been researched to be improved, researched to be more effective, researched to be safer and healthier for us. And then vaccines are tested and updated as needed to work even better. This is a really interesting statistic. Vaccines save an estimated 42,000 lives every year in the US alone. So 42,000 lives every year is actually 3 times more than seatbelts and child restraints combined. And I can't imagine putting any of my kids in their car seats in their car without their car seats or their seatbelt. And the way I kind of think about it is the vaccine is a seatbelt. So it takes one fateful event for my child's car seat or seatbelt to save their life. And it's very similar with vaccines. It just takes that one fateful event, one fateful exposure for my child's vaccine to do what it needs to do to save their life. And so, if you can start kind of presenting immunizations and the immunization program and vaccines as another thing that you can do to make sure your child has an optimal life without the repercussions or damage if they survive a preventable disease, then maybe this is a good way for you to kind of approach it with folks that you're talking to. And number 5, vaccines offer protection to us, sometimes in different ways. So this is interesting as well. Newborns receive some immunity from their mothers that lasts roughly the first 2 months, give or take, depending on gestational age and other things around their health when they're born. But it does wear off when they're still very young, which is why we start CDC recommendations are to start vaccinations at 2 months old. And it's important to remember that some people can't get vaccinated because either they're too sick, like my daughters who couldn't get their 2-month vaccines, or some folks may have allergies to the vaccination. So vaccinating the folks around them is extremely important. So again, this is talking about that fence, protecting our vulnerable population members with herd immunity and community immunity. Getting shots offers protection that will help your child's immune system fight when they are exposed to disease. So there's actually another really cool video we're going to watch. I'm not going to get too deep into that, but I'll point that video out when we get to it. I'm going to pass it over to Wendy. She's going to handle 6 through 10 for us.
Okay. So the sixth thing we want you to know is that vaccine antibodies act as a personal ninja to protect from the actual disease. After someone gets an actual disease, it can take several months to years for their immune system to fully recover, leaving them vulnerable to other illnesses and diseases. So it's better to get the vaccine and expose your body before you actually get sick. Many years ago, when vaccines were developed, they had a lot more antigens in them. As you can see on this slide, 30 years ago, there were 3,000 antigens to protect against 8 different diseases by age 2. And today, we're using about a tenth of that, 305 antigens to protect against almost double the amount of diseases by age 2. So that's a huge advancement. The vaccines have been refined. They're never, once a vaccine is created, it's never just pushed aside and said, great, we did it, we're done. It's constantly looked at, improved, tracked. It's continually being monitored. And the vaccines create memory. So when your body's exposed to that disease in the future, the memory kicks in and says, no thanks, I've already seen you, we don't need you here, bye-bye, and then you don't get sick. So it prevents infection. That's really important to remember. So, we talk about, of course, community immunity, Kai mentioned a lot, which is super important. But on the personal level, these vaccines are your little ninjas to protect against disease. Next slide, Kai. Okay, thank you. And Kai mentioned this, babies get their first vaccines from mom. So there is both a benefit to mother and baby when they get a vaccine during pregnancy. The rates of pertussis drop by 91% when mom receives Tdap during pregnancy. So the baby is protected in those first 2 months when before they can actually start getting vaccines themselves. And flu is reduced by 70% to the infant when the mom gets flu vaccine. I've had 2 babies born during the height of flu season, and it gave me peace of mind to know that I got the flu vaccine when I was pregnant, and they were protection. They had some protection before they were old enough to get the flu vaccine themselves. New recommendations focused on pregnant mothers that they get the flu and pertussis vaccine with every pregnancy. So it's not just once, it's with every pregnancy to protect the baby during those first couple of months. And it's important to talk to your OBGYN about when to get these vaccines to make sure you're getting it at the optimal time during pregnancy. And this is a big one. We hear a lot about the flu vaccine, and really the best defense against the flu is getting a flu shot. We hear about it a lot. I think even, this flu season, it's even more important than past flu seasons. They're talking about the double exposure because we have COVID and we have flu. So if you were to get both the flu and COVID, you'd be, first of all, very, very sick, and really increase your chances that there would be some harmful side effects and harmful and lasting repercussions from both of those diseases. So it's more important than ever to get the flu vaccine, get yourself vaccinated, get your family vaccinated, encourage the families you work with to get the flu vaccine, and really to ask any questions that they have. Ask their doctor, because they will give them the best information. They know those families, they will work with them. People have a lot of concerns about the flu shot. So it's very important to really talk to the healthcare providers to get that correct information. And one really important thing to really keep in mind is that there are so many professional organizations that are supporting vaccination. They support science and they support vaccination. The American Academy of Pediatrics, the American Academy of Family Physicians, American College of Obstetricians and Gynecologists, American Nurses Association, the Centers for Disease Control and Prevention, and the March of Dimes. These are just some of the organizations that strongly support children getting, keeping up and staying up to date with recommended vaccinations. So if you have a question about it, ask, or you can refer your families to their physician to ask them about vaccinations. Physicians themselves overwhelmingly vaccinate their own children. And I think, you are trusted professionals with the families that you're working with. So telling them, oh, I did get my flu shot and I do keep my children up to date. And, we fully vaccinate our family. I think that's a strong message that you're sending. If you're going to do it if you're going to recommend it to them, it's something that you do yourself and that is a positive thing for your family and the community. And then we have school. So it's important for children to be up to date on shots, because when they enter the classroom, they're in close contact with many other children. And of course, children are known for sharing lots of things, and they're told to share lots of things, but that includes their germs. So disease can easily spread through schools and when they're in close contact. You don't want your child bringing home anything that could be preventable. So it's really important to make sure that your children are up to date. I know that my daughter started kindergarten this year, and although it looked very different, we still made sure that she had her vaccines and she had everything she needed to start school. And when she goes back, she will be protected, and she will help protect the kids in her class as well. And also, they still need protection as they grow. So like I mentioned, my daughter started kindergarten this year, but I know as she goes through the school system, as she gets older, we will need to keep her up to date and make sure that she is getting all the required immunizations for her age group. So it's not just the little ones, it's not just the 2-year-olds that we're talking about. So up through elementary school and high school and even before college. And even that, as they go into adulthood, it's super important that you maintain that the open lines of communication with your physician, and are making sure that they are receiving the vaccinations that they should receive that's appropriate for their age. And it's always, as I mentioned before, it's always updated. So, there might be something new that's coming. I mean, we know there's going to be some new vaccines coming. And it's important to kind of be aware of what's on the horizon. And that's not a job that a parent is expected to stay up to date on. We've got lots of things that we're worrying about. But that's where that relationship with the physician and the relationship with other healthcare professionals really comes into place, so that you can rely on them. You can trust the information and the guidance that they're giving you to help make sure that your family is protected and that everyone is getting what they need as they grow throughout their lifespan. So now we're going to watch a video, to really understand how vaccines work. I think this is going to be really come into play and hopefully answer some questions about vaccines that are coming down the pike and really kind of get you thinking that way. So during this video, we also want you to think of questions you have about vaccines, and maybe questions that you hear from families, questions you have yourself, questions that you hear from people in your circle. So hopefully we can address those and arm you with the tools to be able to confidently answer those questions, or refer you to places that have the answers to these questions.
Aren't you glad you don't have scurvy?
I apologize. That was my fault.
In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. But luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. Now, right now, the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and I mean, measles, it's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, well, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. And car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. And that's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you want to read some amazing books about vaccines, check out Seth Mnookin's The Panic Virus and On Immunity by Eula Biss. Links in the description. Stay curious. Today we know that citrus fruits cure scurvy because...
All right, so I personally, this is my favorite video in all of the presentation. I think it's a little bit witty, it's really fun. I know it gets a little technical in there, kind of mid-end, but I still think it's super appropriate. If you have an opportunity like our WIC folks do, or maybe some of our individuals in some of our other organizations that are present today, if when they're waiting to go back for their meeting or they've checked in and they're filling out their paperwork, if you have a chance to hand them a tablet that has a video or two on there like this one, I think it would be really impactful, and something maybe you should try to consider. This is definitely something that is community appropriated. I don't think it's anything that goes way over anybody's heads. And so I think it's something that we do need to consider in terms of a resource that we can use to disseminate this information. That's both fun as well as extremely informative and not too pushy. So something to keep in mind. Looks like we do have a question about maybe flu shots. I don't have access to the chat right here, but Wendy, do you have access to that chat, and
Yes,
or do you want to address that question?
Yes, so we have a few questions. And for everybody who has joined us, if you have a question, you type it into the chat box. We are responding to that. So I'm just going to read them just so that everyone can hear. So one is about how families would know if their children are allergic to vaccines. And this is a really good question. I know people are concerned about this, but allergic reactions, and so this is in the chat, I'm just going to read it to you. Allergic reactions are actually very rare, and approximately 1 in a million people have a reaction to a vaccine. Your health professional will monitor your child after a vaccine is given to watch for any reactions. And you also get a handout with possible reactions to the vaccine and when to contact your doctor. So after you get those shots, you always go home with a stack of papers. And on there, it talks about what to look for. So that's something to remind parents. but it is very rare. I think, you hear about it. It gets a lot of attention, and some people say that it's an allergic reaction to vaccine, but an actual allergic reaction is pretty rare. The other question was about the flu. So what do you tell parents that refuse to get their child vaccinated because they say it makes them really sick? So they get the flu shot and then they say they get the flu afterwards. So the CDC says flu vaccine side effects are generally mild and go away on their own within a few days. It's important to remind parents that flu can be very serious, and many people die every year from the flu. The flu vaccine is around 50% effective in preventing the flu and lessening severe symptoms. And there's a website in the chat box if you'd like to know more about that. One thing that this is something that you should definitely pay attention to, but my daughter had a fever after she received her first dose of her MMR vaccine. And of course I was very scared, but people that I spoke to in the immunization world said, that's a wonderful sign. It shows that she's having an immune response to the vaccine. And that actually made me view this terrible, of course I was concerned for her. I didn't want her to be in pain. I wanted her to feel better, but it helped me view it in a positive light instead of a negative, oh, this vaccine gave her a fever. It's like, no, this vaccine is working. It's going to prevent getting measles, mumps, and rubella in the future because her body's having a reaction to the flu shot now, or to that vaccine now. So I like to think of it that way. It kind of turns it from a negative to a positive. So keep putting your questions in there, and then we'll answer them. And then what we're going to do now is go through some common questions, and then so you might hear an answer to one of your questions in there as well. So please keep them in there and pay attention to the chat box, and we'll put answers in there as well.
Thank you, Wendy, for doing that. I definitely want to double down on what you said about kind of the first time parenting scares of immune responses to vaccines, immunizations, because I experienced the same thing with my firstborn little one after the rotavirus. She had a little fever and diarrhea, and I was like, oh no, she's one in several million that had some kind of reaction. And I was reassured by her pediatrician as well. No, actually a fever is a great thing. A fever signifies immune response. It means that her immune system is working, it's recognizing what's happening, and it is mounting a response as we speak. This is a great thing. Of course, you should discuss any symptoms or any concerns with your healthcare provider. Absolutely. That we're just here to help people answer some of those harder questions. But an immune response is not necessarily a bad thing, and it's something we want to make sure that our families and primary caregivers are well aware of. So we are going to go here. Here we are. Common vaccine concerns. So these are seven of the questions that we hear primarily in the healthcare world and in the public health setting, and some that I'm sure that you may have heard too. So we're going to kind of tackle these one by one. As Wendy said, please make sure you keep putting your questions in the question box so that we can see if any of those haven't been addressed here. And then again, we'll have tons of resources available to you at the end of this as well. So I'm going to tackle the first couple of questions. The first one is, let's see, a couple of your friends, okay, let's try this again. A couple you are friends with tell you that they worry newer vaccines are not safe. They worry that the pharmaceutical companies make vaccines without testing them before they're given to kids and adults. What resources do you have available to help them with their concerns? So this is a fun one. And admittedly, I was one of those people too. When my first little one was born, I wanted to talk to my pediatrician about a lengthened vaccine schedule, a vaccine schedule that made me feel more comfortable. And I'm not going to say she shot me down immediately, but I am going to say that she provided me with some amazing education that really adjusted my perspective. And I think the primary thing here is we're following the CDC guidelines because the CDC has done tons and tons of research about the optimal times for kids to get vaccinated, when the body can optimize that vaccine. So that's definitely the primary thing, is our bodies are not overloaded. But some of the resources we have to help you kind of have those conversations with families are here on the left, the journey of your child's vaccine. And we're going to watch a little video on that as well. One of the other things that pops up is, hasn't it been proven that there are dangerous hot lots of vaccines? And the FDA regulates the production of vaccines very carefully. The concept of hot lots is false. It's a myth. It's based on the presumption that more reports of adverse effects means that a vaccine lot is more dangerous. And it actually doesn't mean that at all. Essentially, a lot of vaccines can vary in size from a couple 100,000 to several million. So if you think to yourself, a lot of 100,000 vaccines has 1 or 2 reports of an adverse effect, you're going to expect that the lot that has 7 million vaccines is going to have more reports. I mean, if you think of this statistically, 2 for 100,000 versus how many for 7 million. So there's no hot lot, but there are changes in the size of the lot that may be feeding into that myth or concern. Here's a fun little video we're going to watch real quick.
The journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine safety and how well it works. These trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. The FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. recommended immunization schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. recommended immunization schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious diseases. For more information, please visit cdc.gov/vaccines or cdc.gov/vaccine-safety or fda.gov/CBER.
Awesome. Okay, so I know that video is a little bit more lengthy and might not be necessarily appropriate to show your parents or primary caregivers. But if you could take a couple pieces of information from that and just kind of have it as anecdotal evidence or just kind of to be able to deliver off cuff, I think that's really important as well. Lots of really good pieces of information in there about the journey of a vaccine. And we are going to talk about the hot new vaccine that's about to hit the market just a couple of minutes here. I know that's what a lot of us are really excited to chat about here. But I do want to just kind of point out to you that when we talk about the safety of vaccines, especially when we start talking about the COVID-19 vaccine, there is a ton of detailed information that goes into just phase 1 of authorizing a vaccination for community-wide use. So just phase 1, if you recall seeing all of the different details that were involved in that before we could even move on to phase 2, I think that might help people feel a little bit more reassured that there is a ton of safety measures that go into not just putting a vaccine out on the market, but developing the vaccine before anything happens in the lab at all. So definitely something to remember. Watch that video again once or twice or 3 times even, so that you've got some additional information about the process before these vaccines are even made available to the community.
The journey.
All right, the fun stuff, COVID-19 vaccine. We're all super excited about talking about the COVID-19 vaccine, of course. One of the unique positions that we're in right now is that we don't have the luxury of generational fatigue when it comes to COVID-19 and this pandemic. We don't have the luxury of forgetting exactly how terrible this is for us right now. And not just for us. I mean, if we're here sitting in front of the computer being able to take part in this webinar, then we're probably pretty okay. But the folks around us may not be. And so we know exactly what's happening right now. And so now is a really great time for us to strike while the iron is hot and have this vaccine conversation, this immunization conversation, because it's about more than just the COVID-19 vaccine. This is about the vaccines that have proven to be effective before the COVID-19 vaccine that allow us to be sitting here talking about this. So first things first, the safety of the COVID-19 vaccine is top priority. And this is kind of important to mention because we really were on this really streamlined, get it in, get it done fast kind of feel. And so it's really important for all of us to realize that the safety measures were not just kicked aside. The safety measures were all definitely still in place when developing the COVID-19 vaccine. But because we're in the middle of a pandemic, much like with polio, we were able to develop this vaccine very quickly because the amount of people they had testing positive was so huge that what might typically take, many years to even a decade, they were able to get done in an extremely short amount of time, a compact amount of time, because that's how many exposures we have in our community right now. So again, the numbers are the same. We were just able to have this super condensed time frame because of the incidence or the rate of infection. At first, the COVID-19 vaccines probably won't be recommended for kids. And this is because kids were not included in the trials, in the clinical trials, to determine its efficacy and its safety. So until a vaccine is available to the public, we must use every precaution to protect ourselves and our families. And then when the COVID-19 vaccine is available, of course, we're gonna follow the CDC's recommendations and guidelines for vaccinating our most vulnerable communities first, which is so far what it sounds like the plan is. And so we do need to start thinking about this herd immunity or community immunity that we've been thinking about previously with our other vaccines, which is allowing folks to get vaccinated and then building that fence around our most vulnerable communities and folks who can't get the COVID-19 vaccine right now. For example, our kiddos. So just like every other vaccine that we've started in the community, the COVID-19 vaccine is going to be the same. We're going to get vaccinated. It's extremely important to get vaccinated. Once everything is deemed safe and signed off, then we want to make sure people are getting that done. And then we're going to start protecting our most vulnerable in the community as well with community and herd immunity. I don't think I missed anything there. I think we got everything there. Let's move on to the next slide. Please do your part to stop the spread of COVID-19. This is probably, deeply ingrained in your DNA even. You've heard this so much. Many of us honestly are very fatigued, but it is especially important now as we're dealing with surges and the holidays and other things that we're all just kind of used to doing in our lives, that we do what we can do to protect ourselves and others from COVID-19. Because we do need to remember that while a vaccine is on the horizon and we are all very hopeful, we don't have it yet. And so we do need to make sure that we're still being as safe as we possibly can in the interim. So please, whenever possible, avoid being in any setting with more than 10 people. You could do less. If you can do less, you should do less. But 10 is kind of the golden number. Always keep at least 6 feet of different distance from others when out in public. Whenever it's possible, limit contact with those outside of your household, especially if you're in a high-risk group. Always stay home when you're sick. This doesn't just go for COVID-19. This goes for everything. If you're not feeling well, please stay home. This is the best way for us to stop community spread of preventable diseases. Always stay home as much as possible when a household member has tested positive for COVID-19. You may or may not know this, but if a person has tested positive for COVID-19, the only people who are being asked to quarantine are the people who have been in direct contact with that person. It doesn't mean that the people in your household are also being asked to isolate or quarantine. So, it might behoove you to use common sense. If dad was at work and exposed to somebody with COVID-19 and it was asked to isolate, then it's probably in your best interest for dad to have his entire family quarantine or isolate if possible. Let's see, and we do want to make sure that if a household member has tested positive for COVID-19, nobody leaves the house except for essential medical care, prescriptions, and have your food delivered or see if someone can drop it off. That's kind of the best way to go about it, it seems right now. Please frequently, and this goes again for everything, not just COVID-19, but especially for COVID-19, wash your hands frequently with soap and water. I've got all of my kids doing the ABCs every time we wash our hands. It's Baby Shark is a great thing to do. If you want to sing some kind of orchestral something in your head while you're washing your hands on your own private time, do that. But please make sure that we're using soap and water, or you can use an alcohol-based hand sanitizer if you're not able to wash your hands. Washing your hands is, of course, the most effective way to stop COVID-19 over hand sanitizing. And then lastly, always wear a mask or cloth face covering when you're going out in public. They should not be worn by kids under 2. I don't think this is stressed enough. Kids under 2 shouldn't be wearing masks for physiological reasons. But anybody over the age of 2 absolutely can and should be wearing a mask. Let's see. Yeah, okay, I think that, go ahead.
We had, we just wanted to point out, this is in the chat box as well, but TAPI has a COVID-19 resource page with frequently asked questions, vaccine information, lots of good information. That link is in the chat box. So please be sure to bookmark that and go back to that. So when you do get these questions, because we know people are going to be asking questions, and rightly so, it's something new. People are curious, and I think questions are good, but you'll have the right information to share with them.
Thanks, Wendy. All right, so moving away from COVID-19 for now. The immunization conversation of too many vaccines at one time. And sorry, this is kind of what I was referencing earlier when I had said that I had talked to my baby's pediatrician about a delayed vaccine schedule. So the example given here is mom and dad both think vaccines are good, but that babies get too many at one visit and their immune systems are still too new for so many. They plan to delay some vaccines and only get 2 at each visit. What are some things you can say to educate them and reassure them? And I'm wondering if actually you guys want to put some answers to those questions in the chat box here. I'm going to give you, let's say like 60 seconds, because this really is one that people see very frequently. My pediatrician did an excellent job, and I'd like to know how you would handle it. So go ahead and put those answers in the chat box, how you would handle a mom and dad agreeing that vaccines are good, but they feel like kiddos get too many at one time, so they want to delay them. Perfect. Keep putting those answers in there, please.
I will open it up. Let's see.
Yeah, I'm seeing some really good answers here. Keep going, guys. There's 80 something of you on here. Let's flood this chat box with some ideas here.
And we're just told that you all can't see other people's answers. So there's no such thing as a bad answer. If we get a couple of the same, that's great. That means the message is getting out there. So I'm just going to start reading them since not everyone can see them. People's immune systems are constantly responding to thousands, if not millions, of bacteria and virus, and most of them are not dangerous. So that's really good. That's from Carolyn.
Yes. I see one that says it's important for your child to receive immunizations at the same time because it will protect their immune system. Receiving vaccines all at the same time will not cause any harm. That's great. Thank you, Jessica.
And Megan says the CDC has researched when it's optimal time for children to get vaccines. I think that's really important to stress. People didn't just decide, oh, okay, we'll just do them all right now. They did the research. They know that this is when the body has the best immune response. So that's perfect. That's great.
Yes.
And encourage them to discuss their concerns with their doctor. That's a very good answer.
And that's always the go-to answer, encouraging them to discuss their concerns with their doctor. This is always the best answer. However, sometimes we can offer some information to at least dispel myths or concerns as they pop up, so they don't have a ton of time to manifest and cause parents to ruminate and really panic, especially when we talk about if I can't, as a trusted professional, kind of help guide you, and I let you jump on Google, because we all know how great Google is. If I let you jump on Google and you type in, why are too many vaccines bad for my daughter? You're going to get a lot of articles about they're factual or not, credible or not, about why too many vaccines are not good for your daughter. You'll get caught in the bubble, the rabbit hole, if you will. And you're going to have that echo chamber of information popping up on Google about why vaccines are bad for your daughter, why too many vaccines are bad, why any vaccines are bad, why you should go live in a commune somewhere. I mean, all of this is just going to start popping up, and it's going to start flooding somebody's mind with non-factual information, with fake news, if you will. So yes, definitely we should be deferring folks with concerns to their healthcare providers as well. But if there is some basic information you can provide that kind of helps point them in a healthier direction, we do want you to be armed with that information. And I did kind of give away the answer earlier accidentally, which is, tons of research goes into this, tons and tons and tons of research goes into the timeline. And so these timelines exist because this is the optimal time for this little one's body to be able to utilize that vaccine. So again, it's important for us, as much as we'd like to set up some kind of delayed vaccine schedule, to try to follow the CDC guidelines as much as possible. And hopefully this child's pediatrician will provide that same information.
So there's just a few more I wanted to read.
Yeah, go ahead.
See, the human immune system is developed with constant exposure to lots of germs, and vaccines are just a drop in the bucket. So it's, and we're going to listen to a video later that talks about how many things we're exposed to every day, and the small amount that vaccines are actually, the actual exposure of them. The FDA does rigorous tests to determine the time frame allowable for vaccines and what is the best time frame for receiving them. So that's really good. That's I think that's a good message for everyone. And then another one that this is really good as well. It's better to get them at the same time to prepare their immune system and prevent disease and getting sick. So, the earlier you can get them, the earlier, that is, of course, recommended by the CDC and that has been tested and proven by science. The earlier you get them, the less likely it is that they will be exposed to that disease and get sick from that disease. So if it's delayed, that increases the time period that your body is at risk. So that's a really good one as well.
Excellent. Yeah, Ariana, thank you for that.
Yes.
All right, we got to move along, so we don't have a lot of time left. We have so many things we want to talk about. These are excellent resources for the conversation about too many vaccines. Again, these resources are going to be available to you at the end of this. So this is generally what they look like. Children's Hospital of Philadelphia is excellent for resources, as well as the CDC and FDA, which you're going to see a million times throughout here because they are the go-to entity for a lot of these questions. I'm going to skip this video. This is a video by Dr. Paul Offit. You will have access to it a little bit or at the end of the presentation again, just because we're kind of running out of time and there are some important things we want to make sure we touch on. So I do think we kind of got the gist of it, hit the nail on the head in terms of the conversation around too many vaccines. Okay, this is one I think is super pertinent. Ingredients. Mom says she's heard that there are really dangerous chemicals in vaccines like formaldehyde and mercury, and is not really sure she wants to vaccinate her child. What are some things you can say to educate her and reassure her? And this is, I think, super important because this is something that we keep hearing a lot. And as we have vaccine exemptions on the rise and more folks choosing not to vaccinate their kids, from what I am hearing, a lot of it seems to be around the concern about ingredients. So we're going to watch this quick video here. I'm going to skip forward a bit. We're going to watch this video with Dr. Offit so that he can kind of provide an expert's medical opinion on the mercury specifically in vaccines.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center here at the Children's Hospital of Philadelphia. I think one of the concerns parents have is about a potential additive to vaccines, the preservative mercury. Is mercury in vaccines? And the answer to that question is that mercury is in some multi-dose preparations of the influenza vaccine. The form of mercury is called ethyl mercury, and the name of that product is called thimerosal. Now, one could reasonably be concerned about this, knowing that mercury, certainly at high concentrations, can be toxic to the brain and so-called the central nervous system. But in order to understand, I think, why it is that the mercury that was contained or is contained in some multi-dose preparations of the flu vaccine isn't harmful, I think we need to step back and try and understand mercury in our environment. Mercury is in the Earth's crust. It has been ever since the formation of the Earth. It's in an inorganic form through things like volcanoes and rock erosions. That inorganic mercury comes to the surface of the Earth, where it in soil or on the surface of the seas, it is taken up by bacteria and methylated. So it goes from inorganic mercury to methyl mercury. That methylmercury is now organic mercury. It has the capacity to cross cell membranes and do harm. Now, the quantity of methylmercury that's in the environment is actually far greater than one would ever be exposed to in the mercury that's in vaccines, which actually isn't methylmercury. It's ethylmercury, and it's a larger molecule, and as a consequence, is excreted from the body 10 times more quickly than is methylmercury. So whereas methylmercury accumulates to a far greater extent in the body than ethylmercury, I think parents should be reassured by that. But I think more reassuring is the fact that just to know that because we all are exposed to methylmercury all the time, and it's in anything that's made from water, including breast milk and including infant formula, that babies are exposed to far more methylmercury in what they drink as young infants, either in formula or in breast milk, than they would ever get from the mercury in vaccines. And remember, the vaccines or influenza vaccine isn't given to less than 6-month-old children. So again, there's no avoiding mercury, and as is true, there's no avoiding many heavy metals in the environment. We all have cadmium, thallium, beryllium, even arsenic in our body, but it's at quantities far below that would ever do harm. Hope that helps. Thank you.
Thanks, Dr. Offit. It does help. So let's push forward here. So that was kind of a wordy way of essentially saying that, yeah, there's mercury in there. It's not the formation of mercury that causes significant damage or even concerning effects. And furthermore, the amount of mercury inside these vaccinations is so minuscule that every other exposure in the world for baby is going to provide more mercury than their vaccines or their immunizations. So some fun facts to share about the vaccine ingredients that are naturally occurring in our body. If you recall him saying, we've got things like cadmium and arsenic even in our bodies occurring, daily. And why they're in vaccines. Aluminum is used to agitate the muscle in vaccines. So essentially when the vaccine is injected, the aluminum causes the muscle to start agitating so that it can start recognizing that there is a foreign body there. This is so that it knows that the vaccine is something that it should start mounting antibodies for. Formaldehyde is used to kill is used in the early manufacturing to kill bacterial organisms. It's in like the least trace amounts possible when the vaccine is finished in a finished vaccine, but it is true that formaldehyde is used early on in the process to make sure that the vials or the vaccine is not taken over by bacteria or any other organism. And then thimerosal is used in multi-dose vials to prevent bacterial contamination. We don't want in a multi-dose or multi-use vial for a needle to go in that has some kind of potential contagion on it and infect the entire vial of a multi-dose vial. So thimerosal is used as an antibacterial, if you will. And then on that graphic, it says in the first 6 months of life, infants receive more aluminum in their diet than from vaccines, which, as Dr. Offit said, was through either breast milk or through formula. Lots of research out there has shown that there are pretty significant heavy metals in formula that do not cause any type of effect on little ones. For formaldehyde, there's more formaldehyde naturally circulating in an infant's body than contained in any vaccine. And then lastly, there's more mercury in a can of white albacore tuna, which I love, than in some flu vaccines. Okay, so I'm going to pass it over to Wendy. She's going to chat with us a bit about autism. We're going to watch a couple of videos here as well. Go ahead, Wendy.
Yep. And I apologize ahead of time. I am going to try to go through these pretty quickly, just in the interest of time. And I think I'm a good person for that since I talk pretty quick. So I apologize for that for earlier in the presentation as well. So this question, a mom of a 13-month-old toddler is sharing in her mom's group that her baby is not the same as she was before the MMR shot. She's worried that the shot caused harm and wants to warn others about vaccines and autism. So unfortunately, this is something this misinformation is still out there. And it is something that you're likely to hear and that we're especially likely to see on social media. So we have some resources that are available. And these are, well, actually, I was going to say, these are similar to what we've seen because a lot of them are from the same places, but this is actually a local resource that was developed by TAPI and I can't read that, the Arizona Autism Coalition. So we got our experts here in the state and created this great handout to be used because just to demonstrate that we know that the risk from the diseases the vaccines are meant to prevent are dangerous to the child, and that the risk of developing autism from these is it's non-existent. There is no correlation between the two. So we're going to watch a quick video.
All right, let's get this going here.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. I think probably one of the most common concerns parents have about vaccines is, do they cause autism? Certainly very easy to find that contention on the internet and in chat rooms, so it can be scary. And I think from the parent standpoint, they argue this: look, my child was fine, they got a vaccine, now they've developed signs and symptoms of autism. Could the vaccine have done it? Well, the good news is that's an answerable question. And it's really been in three different areas that this issue has been raised. One is the concern that the combination measles, mumps, rubella, or MMR vaccine caused autism. The second is the notion that there was an ethyl mercury containing preservative that was in a number of vaccines. Now it's only in some multi-dose vials of influenza vaccine called thimerosal. And then the third sort of concern is that children are just getting too many vaccines too soon, that that's somehow weakening or overwhelming or perturbing their immune system. Well, these are studyable questions. You can answer this question. So, for example, in the case of measles, mumps, and rubella, there now have been 18 studies done in 7 different countries on 3 different continents involving hundreds of thousands of children who either did or didn't get the MMR vaccine, making sure that those two groups are otherwise similar with regard to their healthcare seeking behavior, their socioeconomic background, their medical background. And again and again and again, those studies all found the same thing, that the MMR vaccine did not cause autism, and that's been true also for these other two concerns. The good news is I think most parents get this. I think most parents believe these studies because a recent study by the Autism Science Foundation found that about 85% of parents of children with autism now are comfortable that vaccines weren't the cause. Thank you.
So our friend, Dr. Offit, we've seen him a bunch today, had some really good answers for that. And there are more resources for it. I think it's especially important to remember that and he kind of mentioned this, the signs of autism, and physicians and healthcare providers start screening for autism right around the same time period that babies are getting that first MMR. So they say they got the shot and then this happened, and my baby is totally different. It's what we like to say is correlation does not equal causation. So Dr. Lewis, which I'm sure many of you may be familiar with, she works for the immunization program at the state, used to say, I put gas in my car and then I got a flat tire. The putting gas in your car did not cause the flat tire. They just happened to happen at the same time. So it's very similar to that. The signs become the social emotional symptoms of autism start to present right around the same time that that babies are getting this vaccine. So again, it's a conversation that they need to have with their healthcare provider, and there are lots of resources out there to help answer that question. Okay. Our next conversation, a family you're working with just attended a chickenpox party so that their kids could have a chance to get the disease and boost their immune system. They want to know if chickenpox and measles parties are a good idea. And hopefully, I feel like these are a thing of the past, but I think that because I know that they are harmful, but I think this is something that still is happening, unfortunately, and that we do, again, have some good resources to help answer that question. We have some resources, again, from the Children's Hospital of Philadelphia, and this Immunization Action Coalition presentation, which was linked on this presentation several times, has some really good slides about how to answer a bunch of these questions that we've already gone over today. My only thought as a parent, and listening to that pertussis baby earlier in the presentation, I want to prevent my child from getting sick from anything. So even though people say, oh, measles isn't really that, measles isn't that dangerous, it's okay, they'll get sick for a while, they'll get better. And for some people, that's what it's like, but they're still sick. I don't want my kids to be sick ever. I don't want to have to, try to make them feel better and just watch them suffer. And I don't want to ever feel bad. I don't want them to ever feel bad. And also some kids can get very sick from measles, and it can cause lifelong problems down the road. So measles parties, chickenpox parties are not the best answer for building immunity for these diseases. We have vaccines that are very effective at preventing them and have no lifelong side effects. So we can go to the next slide. And we do have another video. Let me see. I'm going to skip it. It's a short one, but I'm going to skip it just because we're kind of towards the end. Here's a question about school requirements. Mom received a notice from her preschool that her baby is behind on the required school doses. You also notice that the baby needs pneumococcal, but mom declines that vaccine because she wants to get the most important ones. So she's equating the important ones, the ones that are required for school or preschool, versus the ones that are recommended. So we have some resources on that. School and childcare requirements are based on rules and policies decided by the state. So these are different from state to state. You'll find different requirements, different rules that for childcare and for school. It's much harder to change school rules and state rules and policies than it is for the national recommendations. So oftentimes we are behind what the national recommendations are. We got a question earlier about personal beliefs. Let me actually pull it up real quick just so I get it right. Let's see. Sorry about that.
Wendy, I see it here. Do you want me to read it for you?
Sorry. Yeah, go ahead.
Sure. I was asked by a parent whose child is enrolled in our child care program why child care cannot utilize exemption forms for personal reasons, and the exemption was accepted for her son in first grade.
Okay, thank you. So the rules, and again, somebody can correct me if I'm wrong on this information. But when I was with the immunization program, they have the forms have different names. So for school, there is a personal belief exemption. There's also a medical exemption. For childcare, it's not called personal. It's not called a personal belief exemption. It's called a religious exemption. Of course, we want to minimize any exemption. Medical exemptions are for those kids who actually can't get the vaccine, which makes it even more important for all the other kids to get the vaccines to protect that kid who can't. So exemptions are kind of a hot topic, and as Kai has talked about earlier, and we saw on the maps, they're rising in Arizona. We want to work to bring those exemptions down. So I would offer that family some education and see, kind of the reasons behind why that mother was seeking the exemption, and try to offer her resources to minimize the amount of exemptions that we're getting in the state. but they're just named something differently, and that has to do with the state rules and how the laws were written. Let me make sure. And we just got a chat in here. Why is the flu shot optional when it comes to school requirements? And that's actually a great question. I think there's been a big push to make flu shots mandatory for a lot of different groups of people. So I know they, in the hospitals, nurses, support staff, they really try to push it there. But I do not have an answer to that.
I think, if I may, Wendy, I think a lot of the conversation we've been having about the school requirements versus the recommendations is political. It's all political. And so it's going to take a lot to get flu shots to be mandated by the school districts, by all of the powers that be, if you will, the entities that have already added the specific immunizations that are there. A lot of this comes down to the lobbyists and what they want to push for, and what type of legislation is prioritized. And so it really just seems like the flu shot has not been a priority in terms of getting it pushed through, instead of just a recommendation. Did you want to watch this video, Wendy?
We have 4 minutes by my clock, so I think we can go ahead. So this is something I wanted to touch on real quick. Kai had mentioned earlier, you Google something and then you get all of the results. You get lots of different information, and depending on what you choose to read and where you choose to go can really influence what information is shared with you going forward. So it's really important that you're looking at reputable and reliable sources. And TAPI has a great, well, this is from the Immunization Action Coalition. TAPI also has a great handout, but it has a list of different resources. So websites, videos, lots of good resources. So this is something that I would have on hand. And if you have that parent that's questioning, I would just, hand this over and say, hey, this is great. You're going to get lots of information. This is going to be science-based information, and it's going to be accurate, and you can rely on this information. See where we are now. Again, we mentioned the Children's Hospital of Philadelphia a lot today. The Vaccine Education Center. Anything that you're looking for is gonna be there. It's gonna be at the CDC vaccines webpage. TAPI has so much information. So, and then if there's something you're looking for that you can't find, you can always reach out to TAPI and they will help you find it. Make sure that you have the best information possible to share with your families, and just to arm yourself with that knowledge as well. And then let's see. So TAPI has a ton of handouts and resources and tools that's available to the public and available for you to use. They can help with branding, so you can put your logo on it. They can help if you want something and you don't see it listed on the TAPI webpage, they can help you create it. They're always happy to do that. So don't hesitate to reach out to TAPI for any of these resources, or to create anything that you feel would fit your population and your specific need. And I had mentioned it earlier, you are a trusted resource for the families that you work with. They respect you, you are reliable. So I hope that this information is helpful and will help empower you to answer the questions that you're getting from them, to point them in the right direction, and just to really be armed with information that is good, and also that where to go to look for that information. And if you can't find it, that you reach out to TAPI and really let them know what you're looking for, because they have a wealth of knowledge and expertise and can really help you help families make the right decisions. And I think we're at the end.
Okay, thank you so much to our presenters. You guys did a great job. We do love to give prizes, and we have some really fun prizes for you all today. So please follow this link in the chat box to complete a survey and about the training today so we can improve for our next training. We love to hear feedback. And you will, once you complete the evaluation, you'll be entered into a drawing for some great prizes. So that is all. Leave any other questions in the chat. And thank you for coming today. Also, if you are a certified health education specialist or registered nurse, we do have CEUs available for today's training. So you can reach out to me at my email there, and you all got emails from me today, so you should all have it if you would like those CEU credits. And that is it. Thank you. Everyone have a great day. There is a participation certificate also. The credits are for if you are certified, but everyone will get a participation certificate for today. Yes. Any other questions? You can just add them to the chat and I'll try to answer them real quick. Otherwise, that's it. Patty, if you want to email me the list of the participants that are sharing your computer today, we can definitely get you individual certificates for participating. And there's my email in the chat.
Are we ready to end?
Yeah, we should be good. Okay, thank you.